Welcome. Thank you for participating in our first ever virtual gratitude event, Home for the Holidays. This year has been full of innumerable challenges, and thinking creatively has been our new normal. I have a few housekeeping details to review. This is a Zoom webinar, and so this session will be recorded for future use. All participants will be muted and video is disabled, so you can see us, but we cannot see you. To reach our team for technical help, please use the chat feature. To follow along, we have provided a program in your gift box. And during the presentation, you are welcome and encouraged to submit questions for our Q&A session. We will do our best to answer as many questions as possible at the end of the speaking program. And so let's get started. So I'm delighted to introduce Jackie Eastwood, our Foundation Board Chair, a true powerhouse and believer in the impact of philanthropy. Jackie is indeed an incredible philanthropist, and we are fortunate to have her serve as our Foundation Board Chair. Jackie?
Thank you, Chris, and welcome everybody. I hope we're going to get through this without too many technical difficulties, because I'm glad I'm not running it, because I don't know how to do any of it. Thank you all for joining us. This is to honor you all for all you've done for us. And it's been such a cuckoo year that I'm sure you want to know what the hell has that foundation been up to and what have they done. I am pleased to tell you you're going to meet some of the outstanding providers that support our institution, and they're going to tell you what they've done with all of your fabulous donations. This is the reality in a pandemic year of how a loyal team of community supporters can support their local community hospital. We are so thrilled with your contributions. And this year, among all that I've been involved with, is really the year when philanthropy is the most important. Because of you, we are transforming healthcare on the Seacoast. And I'm going to stop talking and let you hear from the people that are the ones really making the difference.
Thank you, Jackie. And now I'm delighted to introduce Jeff Hughes, our Chief Strategy Officer. We are so fortunate to have him also serving as our interim president and CEO. Jeff has been with Wentworth-Douglass for 8 years, and as the chief strategist, he has truly crafted breakthrough strategies, allowing for tremendous growth. Jeff?
Oh, thank you, Christine. And thank you, Jackie, for your energy and enthusiasm. And thank you all for joining us today as we say thanks to you for support of Wentworth-Douglass. A little bit about me. I've been a part of Wentworth-Douglass for about 9 years, serving initially as a Chief Strategy Officer, as Christine mentioned, and later as a Chief Operating Officer. As of October 1st, I have had the privilege to step into the role of Interim President and CEO. As many of you know, as a successor to Greg Walker, I have some big shoes to fill, but I'm up for the challenge, and I'm really excited to partner with all of you to carry our strategic initiatives forward. It is really because of you and your faith, trust, and investment in our hospital that we can continue to invest in the needs of our community. Your philanthropic support helps us to grow and expand healthcare services every day, and for that, I'm just so grateful. It is hard to believe, but at this time last year, Wentworth-Douglass had much of its attention focused on the opening of Building A at our outpatient center in Portsmouth. This building, which is the largest and final phase of this current campus development plan, opened a year ago in January of 2020. This 3-floor, 60,000 square foot building houses a variety of medical and diagnostic services, including cardiology, neurology, orthopedics, primary care, a new women's health center, along with laboratory and diagnostic imaging services. While last year got off to a good start, it's safe to say the rest of 2020 has not gone exactly as planned. The COVID-19 pandemic made sure of that. Even as the pandemic has presented us all with so many challenges this year, I'm proud of how we as an organization have approached this crisis with determination, resiliency, and resolve. We have taken extraordinary steps to ensure your health and the health of all members of our community, caring for the most vulnerable and preparing to meet an unprecedented need. Thanks to you, the Emergency Response Fund efforts that you have supported, we quickly built 2 respiratory illness clinics to safely and effectively care for the people with COVID-19 symptoms. You may also recall seeing the large yellow vents hanging from the hospital windows. These were part of the significant structural changes to convert regular patient rooms into negative patient rooms to really accommodate the surge and the needs of our COVID patients. More recently, in partnership with the state of New Hampshire, we opened a drive-through testing site where community members have access to COVID-19 diagnostic testing 7 days a week. And perhaps most importantly, we figured out new ways to safely deliver the care people need for preventive, chronic, and non-urgent conditions using telemedicine and other technology. I'm so proud of how Wentworth-Douglass, our staff, and our community have risen to the challenges of this pandemic. It is a true testament to our teamwork and resiliency as an organization to adapt to constant changes and our relentless dedication to ensuring the health of our patients and the community. I would also like to recognize the generosity of our community throughout this extraordinary time. I have never seen a more inspiring show of support for our staff during this very difficult time. I'd like to give special thanks to Rick Card and DF Richard Energy, a longtime supporter of Wentworth-Douglass Hospital, who generously made a $10,000 gift to kick off our Emergency Response Fund initiative. Because of the generosity of donors like all of you, the Emergency Response Fund ultimately raised $100,000 to help purchase necessary medical equipment and expand our services, including the respiratory illness clinics, a COVID-19 testing drive-through. These funds also provided for much support for our staff to help them remain healthy, resilient, and ready to provide the best quality of care. Together, we help bridge the gap for those employees whose families were negatively impacted by COVID by providing gift cards for groceries to help these members of the Wentworth-Douglass family meet their basic needs. So our profound thanks to you and the entire Seacoast community for a truly awe-inspiring show of generosity. While COVID-19 has been all-encompassing, we have nonetheless continued to make great strides toward our vision of being the regional hub for healthcare services on the Seacoast. We are now in our 4th year as part of the Mass General Brigham family, and I am pleased to say we successfully transitioned to the Epic electronic medical record system 14 months ago. Now, patients are benefiting from a single shared medical record across all Mass General Brigham hospitals and facilities, benefiting patients through seamless coordination of care. I'm eager for you to hear from my colleagues about the many initiatives made possible because of your generous support, including advances in cardiology, the Seacoast Cancer Center, and the Portsmouth Outpatient Center. We are proud of the investments in capital infrastructure to ensure the best patient experience when you need us most. But because of your support, we can also remain focused on our commitment to be the employer of choice on the Seacoast. Your contributions allow us to offer continuing education and resiliency support to retain a highly skilled and prepared workforce to provide the highest quality care for you and your families. In my role as president, I've had the honor of seeing firsthand how philanthropy is making a real difference here at Wentworth-Douglass. In October, we had the esteemed pleasure of hosting Lloyd Hamm and members of the Newburyport Bank leadership team to celebrate their transformational $250,000 gift to the Women's and Children's Center. Because of this partnership, we will bring expanded services and clinical care to families and children here in the Seacoast. My sincere thanks and gratitude go to Newburyport Bank. Last month, I was delighted to attend a gathering at Somersworth Nissan, where we were presented with an incredible gift of $21,000 from their Drive for a Cure fundraiser. A generous and loyal supporter of our Seacoast Cancer Center, Somersworth Nissan has contributed more than $80,000 over the last 3 years to ensure comprehensive and quality cancer care is available in our community. These are but 2 recent examples of how donors like you are stepping up to support our mission. I know each and every one of you is here today has stepped up in your own way, and for that, I thank you. We could not do what we do without your support. I am very happy to have had the opportunity today to thank you for your unwavering support of Wentworth-Douglass Hospital. Despite the challenging year we have faced and the COVID challenges we are continuing to face, Because of you, there is so much to celebrate. With your support, I look forward to continuing our path of growth and exploration of the many ways we can work together to improve the health and wellness of our community. Thank you again, and I wish you and your families a very happy and safe holiday season. And now I'd like to introduce our Chief Nursing Officer of Wentworth-Douglass Hospital, Sheila Woolley.
Thank you, Jeff. Hi, I think I know most of you. I'm Sheila Woolley. I'm the Chief Nursing Officer at Wentworth-Douglass, and I've been here for the past 21 years. I've certainly seen the incredible impact that your generosity has made on Wentworth-Douglass. We have a long history of philanthropy here, all the way back to Ariok Wentworth. And on behalf of the entire care team, the nurses, the respiratory therapists, PT, OT, everybody who makes this place run, we want to thank you for your commitment. And as Jeff mentioned, everything that you've done during this pandemic has just been so well received, helping to keep our staff safe to do the work they need to do every day to protect our community. So thank you. One of the areas that the foundation supports that's very near and dear to my heart are the nursing scholarships. We have 2 nursing scholarships, one for staff who are interested in becoming nurses, and the other for staff who are already nurses and may want to go on with their schooling or get certification in a specialty. And we have probably, each year we give out about 20 scholarships. We have many, many applicants every year. And it's so wonderful to be able to listen to the stories and why they're applying for a scholarship and what they want to do with that. So I'm just going to share with you a little bit of the stories that we have. They always write thank you notes to the foundation. And this one young lady who's one of our clinical practice leads in the cancer center said, "Your contribution has made it possible for me to further my education. I'm a mom to a 4 and a 2-year-old, a wife and a nurse. Through your generous support, I'm able to show my children that with hard work, dedication, and support of others, anything is possible." Another young lady who works on 3 North, our step-down unit, is interested in becoming a nurse practitioner. She said, "The scholarship will allow me to give back to the community by doing volunteer work. I'm committed to my education into WDH, and thanks to your generosity, I am one step closer to a community-involved nurse practitioner. Thank you for believing in me." Another young lady who started out in food and nutrition and decided to go into nursing said, "Receiving this grant has relieved me of some of the financial stresses that hinders my availability to learn. I've been struggling with materials starting my journey as a nurse, and this has helped me tremendously to keep pushing to reach the overall goal." And last but not least, we had a UNH intern from the health management program working with us as a nursing administration intern. And when she left that year, she applied to the nursing program at UNH. She says, "I began my journey 3 years ago. The first day I walked into this hospital, I felt welcomed, I felt included, and most importantly, I felt comfortable. I am thankful that WDH has provided me the opportunity to continue to work as I further my education, receive my master's degree in nursing and my clinical nurse leader certification. This hospital has surpassed anything I could have asked for." So thank you all. It is just amazing. And I think one of the things that's so great about it is that these young people now give back to the foundation because they are so grateful for everything that's been done for them. So it's just great to see it, how it's paid back. So as Jeff mentioned, we've had many outstanding contributions this year. And this year, the Women and Children's team and myself were very fortunate to be able to work with Newburyport Bank. They gave us an outstanding transformational gift of $250,000, which will help us create the Women and Children's Strategic Initiative Fund. This fund will help us support additional technology and services, which will help provide exceptional and timely care for our patients in the Seacoast. We're going to bring obstetrical care to the next level with specific services. We're going to increase our child life specialists who are out and about. They're in urgent care, they're in the ED, they're in women and children's. They make huge difference to families. And we'll increase the availability of the family education programs, which we've been doing via Zoom since the pandemic began. The foundation supports us in numerous ways. Philanthropic support like yours has allowed us to help the Healthy Start program. We provide such basic needs as a safe sleep location, car seats, clothing, and feeding supplies. We've been able to develop a case manager position for a nurse to work through the practices to identify moms at high risk so they get prenatal care prior to their delivery. And then we hook them up with SOS recovery groups to help them with their substance use recovery. It's been incredibly well received and we've seen great outcomes. So thank you. Jeff talked a little bit about opening Women's Center for Health and Wellness at Pease. This is an outstanding center that we've had some barriers with COVID, but we're getting there. We are so excited to look at this program as a comprehensive care for women. We'll have sports medicine there, nutrition, cardiology. We're really hoping this is going to be one-stop shopping. Dr. Blatt, who's one of our physicians there, wanted to share with you her experience. She says, "Thank you to the foundation. I had a 77-year-old patient who was new to the practice. I noted that he had an irregular rhythm on his cardiovascular exam, and I asked the MA to perform an EKG. The EKG showed abnormalities, and the EKG that we have that you supported directly links to our medical system, Epic. And her cardiologist in Boston was able to review it in real time. They then sent the patient an event monitor, which the patient then wore for 24 hours times 7 days. And they got the patient scheduled for another echocardiogram. The coordination between myself and Dr. N was critical, and it could not have occurred in the timely, efficient, and patient-centered manner it did if we didn't have the EKG that the foundation allowed us to purchase. So Dr. Blatt wanted to say thank you to you all. And you can see, amazingly, how these things make such a difference. Many of you have played in or know about our Wentworth-Douglass Charity Classic. And this year was our 26th year. An unbelievable day. As cold as it is today, many of you can remember how hot it was back then. We were dying. We raised over $230,000. And thanks to you, the Fund Anita program generated $20,000, 30% over what we did last year. And then we were able to match with the contributions from the Patricia Adams Fund. We've now established the Tele Newborn Consult program. This is an opportunity to keep our smallest babies here. These babies normally would be transferred to a tertiary level of care, to Maine Med, to Boston, or to Dartmouth. And you can imagine just having a baby and then having them taken from you and transported to another facility, and you're not with them. This makes such a huge difference to our families. One of the most important pieces about this is that we are able then to collaborate with the MGH neonatologist, working with our pediatricians to assess and develop a care plan for these babies. It's a wonderful opportunity for Wentworth-Douglass and really enhances our program and allows us to continue and maintain our family-centered care. These are just some of the incredible things that you all do, and we thank you for all of them. You're an incredible group of people, and we are so lucky to have you. Thank you very much, and happy holidays.
Thank you, Sheila. I would now like to introduce Arul Mahadevan, our esteemed medical director of medical oncology at the Seacoast Cancer Center. Dr. Mahadevan not only talks the talk, but he walks the walk, as evidenced by his Seacoast Cancer 5K vertical challenge. Cancer does not stop, and neither does Dr. Mahadevan. Arul?
Rule, you're on mute.
I'm so sorry. I'm just joining in to follow some of the very nice comments that have been made by Christine, Jeff, and Sheila. We are all grateful, truly grateful for all the people who are in this call today. You have been part of what we have done for decades, and I'm going to specifically speak to how the Seacoast Cancer Center is grateful for your contributions over the years. I work at the Seacoast Cancer Center for over a decade now, and for the past 7 years, we have done what we call a marquee event, fundraising event in the Seacoast Cancer 5K, which has grown year over year. And I'm looking at all the people that are listed in as participants today. I probably ran into most of them during that event. 2019 was different from 2020 for various reasons that we all understand, but a sea of humanity in 2019 to a significant virtual participation in 2020 during a pandemic was so heartwarming to see. Cancer doesn't stop, right? Pandemic or not. The Seacoast Cancer Center is one of the very few departments has continued to perform and function at peak level right through this pandemic. So we have doubled down on efforts to minimize the potential harm that can go to patients and equally the staff. And we have ensured that everything can be done in a very safe manner without having to disrupt the cancer care that these patients are so accustomed to obtain closer to their homes. A lot of work from a lot of people from March, and it's ongoing right now, as you can see, that has gone into making it work for our community members. Several of you have family members or friends who have come through the department, and our job here at the Seacoast Cancer Center is to provide the best possible care that can be made available to them closer to home. And we cannot do that. We cannot do that without your help. This is a community effort. We are all there to work together to make that happen right here in our community. The 5K itself has grown from, in 2014, from less than 100,000 to last year, it was over 350,000. And this year, we thought, it's not going to be a great event because of all the pandemic that's going on. But surprisingly, we had over 1,000 participants. And I believe we raised over $260,000. That is an amazing effort from all of you to make it happen. So we are so grateful for that. This money that is raised goes a long way in providing survivorship and wellness programs for our patients and their families. It's important that it's just not the patients that need care, it's the family members who come with them, and to support them both emotionally and financially so that they can get through this illness especially during the pandemic time. So without philanthropy to support some of the additional services that need to make that happen, it would not be possible. In addition to the survivorship program, we have integrative therapy programs, and we also have a nutritionist and exercise classes that are offered for our patients and our families. In addition to that, we are always looking at getting in cutting edge clinical trials, cutting edge equipment to make things easier for the patients to go through treatments. And also once they survive, we are able to keep their health in optimal condition so that we can deal with any progression or recurrence in a very effective manner. So as Christine has mentioned before, we have launched several new programs, including the virtual program, and also all other new things that are coming up in 2021. A combination of virtual and on-site program is what we are looking at. We're looking forward to you participating as you have done in the past. And thank you again.
Thank you, Arul. We have a slight schedule change and have as our next guest speaker, Denise Palumbo, our Assistant Vice President for Cardiovascular Services and Imaging Services. Denise is a nurse and holds a doctorate of nursing practice. She's joining us today in the place of Dr. Michael Mazzini, who is pulled away for patient care. Denise works side by side with Dr. Mazzini, is happy to be with us today to share the vision and philanthropic impact of the Center for Heart Health. Denise.
Thanks, Christine. I appreciate the opportunity to speak on behalf of Dr. Mazzini. The success of the Center for Heart Health is directly tied to your philanthropic partnership, and we cannot say how important it's been to our program. This year, Dr. Mike Mazzini joined as medical director. He's not only an outstanding electrophysiologist and cardiologist, an electrophysiologist really works on the electrical conduction of the heart, but he's an amazing physician leader. And what is really unique about Dr. Mazzini's practice is he performs electrophysiology procedures both at Wentworth-Douglass as well as MGH. And literal proof of that is the fact that he couldn't be here right now because he is literally performing one of those procedures on one of our patients at MGH. The diagnosis and treatment of these very high complex cases often require tertiary and quaternary academic center support and need to be performed where there is advanced anesthesia and cardiac ICU care. But the best part is the patients are seeing Dr. Mazzini here and then literally seeing Dr. Mazzini at MGH to perform this procedure. We think this is a real differentiator in the market and the Seacoast, and we think this is what the kind of care that we want to be able to provide that that bridges the gap between academic medicine and community hospital care. So together, Dr. Mazzini and I are charting a course with a bold vision and strategy for the Center for Heart Health. And this future success is really built on the track record of generosity, but many of you attending this virtual event today. This generosity has translated into success for us, and an example of that is PACEART. PACEART is a system that organizes and archives data for implantable cardiac devices, for example, pacemakers, across multiple manufacturers and services, and acts as a central repository for patients' cardiac information. The system acts as a gateway in which this data flows through remote monitoring. It lands in PACEART. It is touched by a clinician to review that data. It is either acted upon or stored, and then winds up in our electronic medical record. We have over 960 patients that are currently being tracked using this software at WDH. Our clinical team interacts with this software every day. The purpose of funding this project was to align the device database with the same platform as MGH. And the good news is, because we had invested in this technology because of your generosity, we will now move to full integration in a single instance of along with MGH's data systems. So this will create another level of seamless care coordination this winter. So at any given time, an MGH doctor or WDH physician could interpret the reports in the electronic medical record. Again, really making a differentiator in the Seacoast. And we couldn't have done it without the generosity of our donors. Another example is our Philip Echo ultrasound. Your contribution this year helped to purchase a new piece of technology to support the Center for Heart Health, specifically this Philips Epic 7C ultrasound machine. This allows the cardiologist to leverage enhanced imaging quality for optimal viewing of the heart structure using very sophisticated transducer technology, which is the probe that actually is applied to the heart to actually acquire the images. This Philips device has given our providers the ability to better detect early signs of heart strain and treat various types of heart disease. And often this heart strain can be seen, for example, in women undergoing a chemotherapy treatment for breast cancer, which would determine whether the patient would have their chemotherapy or whether it would be delayed. Identifying cardiac damage early is key And with this new technology, Wentworth-Douglass Hospital meets all standards of care from the Society of Echography. And with your help, we've been able to turn the need for this groundbreaking equipment into a reality. In late summer, we celebrated the purchase of this technology with a ribbon cutting ceremony where the clinical team were able to showcase this technology features and personally thank our leadership donors for their generous contribution to launch this initiative. Without your support, the ultrasound machine would still be on the capital list of equipment requiring updating. Thoughtful gifts like yours have strengthened our cardiology services to keep pace with the needs of the community and allow us to continue to provide outstanding care to patients across the Seacoast. We think we're the best. On behalf of Dr. Mike Mazzini, the providers, the clinical and support staff, thank you for your exceptional generosity. So from our hearts to yours, the Center of Heart Health, we want to wish you and your family a safe, healthy, and happy holiday season and a wonderful 2021. Thank you again.
Thank you, Denise. That was unbelievable. And now I also would like to thank you, our donors, from the bottom of my heart for your incredible and heartwarming commitment to Wentworth-Douglass Hospital and the Foundation. 2020 was a remarkable year for us in so many ways. If you have heard during this presentation, the pandemic forced us all to think differently and drastically about how we work, how we care for our patients, and how we care for our community, and how philanthropy would continue to play a critical role in supporting the patient care and services we provide. Thanks to the incredible generosity of donors like you, we raised over $1.4 million last year, almost surpassing total funds raised last year. However, knowing that the impact of COVID-19 on our communities and our ability to come together to participate in the Seacoast Cancer Center 5K in person was adversely affected. But you, our community of donors, you all were steadfast in your support of us. The outpouring of gifts, the personal protective equipment, masks, meals, flowers, notes, and signs of encouragement lifted the spirits of our caregivers and was instrumental in helping them sustain their unrelenting schedules. We are still experiencing trying times. However, philanthropy continues to make a difference in how we care for our patients. Philanthropy, your donations, continue to have an incredible impact on patient care. You heard from a few folks about the impact of philanthropy. Last year, we launched 3 fundraising initiatives. The Holloway Challenge for Pulmonary, established by Anna Grace and Paul Holloway in 2019. The Holloways pledged $150,000 to match Wentworth-Douglass's raising of $150,000 over 3 years, totaling $300,000. This challenge will fund a patient navigator position in pulmonary, underwrite capital equipment for cardiac and pulmonary rehab, and support the 3rd phase of rehabilitation for those unable to afford it. We are so excited to share that, thanks to you, we have raised over $101,000 toward our goal of $150,000 and are on track to raise the remaining $48,000 this year. Yay! Next is our cardiology challenge, as Denise mentioned, launched by 4 of our dear friends and supporters, Dick and Jan Conley, and David and Karen De La Penta. They contributed $120,000 and challenged us to raise the additional funds to purchase the new cardiac ultrasound machine at a total cost of $125,000. And as you heard from Denise, the Center for Heart Health was able to purchase that piece of equipment after we raised the balance of funds and to successfully close the 2020 Cardiology Challenge. Our 3rd important initiative was to raise $600,000 over 2 years to underwrite the cost of a new 3D mammography unit for our new Center for Women's Health and Wellness. We have secured $365,000 in funding and hope to hear back shortly from several foundations who are currently reviewing our requests for support, thereby securing the remaining funds to purchase the unit. These are all incredible accomplishments, again, with your support. With these focused strategic efforts and the generosity of donors like you, we are confident this year will be better than ever. There is so much excitement at Wentworth-Douglass Hospital, and the momentum continues to build as we look to the future. but we continue to keep our mission front and center to partner with individuals and families to attain their highest level of health. We continue to partner with folks like my fellow speakers to identify new funding priorities to support new technology and equipment, facilities, and new programs to benefit the community. Your support is so critical to our work. We will continue the Holloway and 3D mammography challenges, as well as our two signature fundraising events, the Seacoast Cancer 5K for the Seacoast Cancer Center and our Charity Classic for the Women and Children Center. Charitable contributions have always been a valued part of the hospital system, but as the healthcare landscape shifts, this is bringing the value of philanthropy into a new light. We are excited for what the future holds and look forward to partnering with each of you to continue to provide world-class care close to home. I want to thank you personally for your loyal and continuous support in enabling us to enhance healthcare services right here in our Seacoast community. We simply could not do what we do without you. And we are so thankful to all of you who inspired us to continue our work through the pandemic. It was not always easy, and you carried us through. You are all awesome. So without further ado, I'm happy to start the Q&A session of our event. And let's see what we have. We have Sheila, a question for you. What is something important that you want the community to know about your nurses and how we're providing care?
Well, as you can imagine, it is a daily struggle. We don't know what's coming in the door. We've certainly seen many, many more COVID patients and have many more COVID positive patients in-house than we ever had before. I'm pleased to say that we have plenty of personal protective equipment, or PPE, as we say in the industry. You may hear horror stories from some other organizations or hear them on the news. We don't have that issue. Being part of MGB and supply chain management, we've been able to secure enough gowns, face shields, eyewear, mask for our staff that's needed. And we have very good staffing. I will tell you that the staff are tired. It's been a long go, just as has been for all of us. But they are dedicated, consummate professionals and are here to take care of their patients. So if there's any, that's how they're doing on a day-to-day basis. We try very hard to meet their needs for resiliency, to provide emotional support through our through our employee assistance program, individually with our psychiatrists and our social workers, because it's challenging. It's challenging to work in this environment, have your children homeschooled, not be able to see your grandma or your grandpa. So we're doing our very, very best to meet their needs. And we have, all of the managers have been extremely flexible in understanding the specific needs of their staff and trying to adjust schedules appropriately. I hope that answered your question. If not, I'm still here.
Thanks, Sheila, you did beautifully. And on that note about COVID tests, we have a question. Perhaps, Jeff, this might be good for you. How many COVID tests do you perform each day, and are the positive tests increasing?
So if I'm correct, and Sheila can certainly correct me, it's about 366 on average. And we are seeing an increase in the 7-day trailing average that we're tracking since the fall. We are seeing more and more COVID people coming for tests. We're also seeing the positivity increase for those results of those tests. And we're seeing that more in-house patients with COVID. The good news is, at least in this round of COVID, although the numbers are a little bit higher, it appears the patients aren't as sick, aren't needing ICU care, aren't needing ventilators the way they were in the first go round. So it's probably a combination, I would guess, and I would defer to my clinical colleagues, but I think one, we know better how to treat it. Two, I think the profile of the patients is a little bit younger. that we saw in the first wave. So I think we're able right now to manage it, but we watch those numbers every day, and we are in constant coordination with the state of New Hampshire, with our colleagues in the hospitals across New Hampshire, as well as in close connection with our colleagues at MGB, Mass General Brigham.
And I think the other thing, just to echo what Jeff said, is we have started self-testing for our employees. And so this is asymptomatic testing. So we have found not a lot, but maybe since we started a week ago, probably about 10 employees who were asymptomatic that actually tested positive for COVID.
So there's another question which serves as a nice follow-up question to the one we just had. How are you keeping staff safe?
So I think there are a number of things. I'll start, and then Sheila can certainly add to that. Sheila's already mentioned that we want to ensure that we have adequate PPE and supplies. And early on in the pandemic, going back to last winter, that was a concern. But really, thanks to the supply chain that we have with MGB, that is not a concern at all. We have plenty of PPE, plenty of supplies. And then Sheila also talked about the fact that we are now offering testing more or less on demand. Whenever an employee asymptomatic wants to get tested, we're offering that for them. It's to help protect them, to help them identify if they are positive and may not have any symptoms, so they can protect not only themselves, but their coworkers and their families. In addition, I think staff safety is utmost in our minds. And we want to do what we can to make sure that our staff are up to date on all of the latest research, all the latest policies and procedures on how to maintain their safety in the work environment, but also their safety out in the community and at home, and how to keep their staff safe. And so anything that we can do to increase that communication and transparency, we're finding is very helpful. Sheila, anything you want to add in terms of what else we're doing to support our staff?
Sure. One of the other things that we did early on for those folks who could work at home, we worked with our IT department to set up their computers so they could work efficiently and effectively from home, and we continue that today. We're also diligent about developing spaces where our staff who are working in the clinical areas can eat and drink 6 feet away from anybody else, because we know this is one of the easiest way that the virus is spread. We also provide, as we said earlier, masks, hand sanitizers to everybody. We've limited visitors, and I know that is an awful thing for everybody, but the reality of it is it's the best way to keep people safe. We do allow visitors for people who have significant needs, whether they be emotional needs or developmental needs or cognitive needs. And we always look at these on a case-by-case basis. Those are some of the many, many ways. And, we do a lot of work with our staff in answering questions about, my son came home from school, there's a child that's positive in his classroom, what's the thing that we should do for our family? Our infection prevention team has been out and is absolutely outstanding. We also have calls with not only MGB every day to assess inpatient volume, but the state of New Hampshire as well, and working as a region to look at capacity at the Seacoast hospitals. So we're also looking at, we've worked with the university to bring in additional staff to help have extenders for our staff, because we do have people out who are quarantining. And so we do need additional help, whether it's for vaccinating, doing testing, running patients, walking patients, being transporters. We're doing everything that we can to keep our staff supported during this time.
Thank you, Sheila. We have a question from one of the participants. What ideas might you have for the 2021 5K if we have to stay virtual? Arul, that might be right up your alley.
That's a great question. And I hope we don't have to continue to remain just virtual, but having learned from what we did as we went along 2020, we are confident that we will be able to do a better virtual event, in addition to hopefully have an on-site event as well, if the health conditions and the state conditions allow for that. So in terms of what we can do better virtually, I think we can, you already know, just to bring up what we already did this year, we have a Raise Joy app, which everybody who can participate, who wants to participate, can download and choose multiple already designated 5K sites within the area and also in the neighboring towns. We have created predetermined 5Ks for people to participate, and that went on really well. There were some participants who did all of those designated 5Ks in one single day, and someone did, I believe, every single day. We had a 2-week event, if you will, for people to do it at their own pace, so that it's not a crowded event on one day. So that 2-week event, there are some people who are doing it 1 5K every day. Those kind of things can be nuanced and done in different and better ways, if you will. We plan on adding more 5K routes across more towns within New Hampshire and our immediate tri-state area, so people can do it right where they are in their own neighborhood. The other thing we want to expand on what we started this year is what I'd like to call a vertical challenge. We live in New Hampshire. We have a lot of 4,000 footers, and we have a 52 with a view. So together we have a 48 plus 52, 100 mountains, which we can climb. And we think that we can leverage that for people to participate the entire summer. As you know, the participation of hikers within New Hampshire from all our neighboring states has tremendously soared. And I actually did every one of the 4,000 footers in the last 2.5 months, culminating on October 31st. So I think that we can do not just a statewide, but a nationwide vertical challenge. What I mean by that is to challenge other people to donate for every 5,000 feet elevation climbed. So if you challenge me, I will climb as many 5,000 feet as possible within a window. So I can do more and more. And in order to get inspired, I need your challenge. So maybe we can all do that to encourage participants around our communities so that they can be outdoors, they can be healthy going around and hiking, and at the same time raising funds for causes that may be dear to them. In addition to that, I think we'll enhance other offerings. If we were to remain virtual, we might do an event like this where we can do challenges or quizzes. We had a quiz that was a very successful event. We may do a few of those during the period around the designated 3rd week of September. By the way, next year, the event date is 26th Sunday, September 2021. So mark your calendars for that. And if it's going to be virtual, it's likely to be a 2-week event around that time, and perhaps stretched over the summer for the vertical challenge. So there are a lot of ideas, and we want ideas from you. Feel free to reach out to us how we can do a better virtual event if that's all we can do. And we are hoping to have a combined virtual and a on-site event. I hope that answers your questions.
A real quick question that just came in. What was the most challenging mountain of all the ones that you did?
You know what? So the challenge is not necessarily the height. Mount Washington was, probably not toughest because of the height, but when I got above tree line, it was 60 to 90 mile gale winds, rain, pouring rain, drenched. I couldn't see nothing. So I just did it. My son was with me for that one. I went through, stood there, said, there was barely anybody there in that weather conditions. Nobody usually hangs around over there, and came down to tree line. So as I went up beyond and came below tree line, it seemed like two different worlds altogether, right? If above tree line, it's like all messy, but below tree line, it's just so beautiful. So in my mind, I would rate that as number one.
Rule, that is true dedication to be out there and being blown around in the woods. God bless you. So next question, can you talk a little bit about the delivery and distribution of vaccines? Sheila or Jeff, do you want to take that?
Yeah,
Sure.
I can start that and Sheila can add in. So, yeah, we have been working in very close collaboration with the state of New Hampshire on the distribution of the vaccines. We expect to receive our first shipment of vaccines as early as the end of this week, so either Thursday or Friday. And we have plans to begin rolling it out to staff next Tuesday is when our clinic opens. The amount that we're getting of vaccines is less than what we had hoped for, at least in the first week. I think statewide, there's something like 12,500 for the entire state of New Hampshire the first week. And of that, 5,000 is going to the hospitals. The amount that we're getting at Wentworth is around 400. And so we've actually prioritized the staff at highest risk for exposure to COVID. And we're beginning with them, and we have a phased program then that will roll this out to staff over the coming weeks. So we are very excited about that. And obviously our staff and our physicians are very anxious and looking forward to getting vaccinated. Sheila, what have I missed?
I think you did well, Jeff. There's been a great team working on this, working with the state. Our director of pharmacy, Bob Terrio, is helping lead this project. One of the things when you give vaccine, you need people to do the injections. So again, it's pulling more staff, more nurses, more pharmacists, those people who are licensed to be able to give injections out to help vaccinate all of our staff. So we're looking forward to it.
Yeah, the only other thing I would add too is that this is currently the Pfizer vaccine. We're expecting that if Moderna gets approved, then our supply of vaccine will increase dramatically. And I think there's one or two other vaccines that are also in the pipeline. So we are just grateful, as Sheila had said early on, that our staff is tired, we're tired. I think the public is tired. All of you, I'm sure, are tired of this. At least there is really hope on the horizon. I think in the history of medicine, this is the quickest that a vaccine has ever been developed and rolled out. And certainly this pandemic, which is nationwide and worldwide, is something that was unexpected. And something that has been a real challenge, but I think we've done well as a healthcare system, not only in New Hampshire, but across the country to address this. So we're looking forward to getting this behind us, and the sooner the better, I think, from all of our perspectives.
Thank you, Jeff and Sheila. So, quick question. So Jeff, what are the strategic priorities for the coming year?
Well, first and foremost, obviously, is COVID. We are really doing everything we can to make sure that we are here and prepared to take care of all patients that come to the hospital. So it's not only the COVID patients, but it's also other patients that have put off procedures. We found when we pulled back on elective procedures back in the first wave, back last winter and spring, that when those patients started coming back, their medical conditions were much more severe, and that many of those patients should not have had to wait for those cares. So we're trying to do everything we can to not only care for the COVID patients, but to maintain our full array of services so that we can treat all patients as we go forward. So clearly COVID occupies most of our time right now. But that said, one of the things that I think really distinguishes Wentworth-Douglass from a lot of other organizations is our ability to move things forward. We have a very active and robust strategic planning process. And although other organizations may have a strategic plan, ours is a living, breathing document. And we actually assign responsibility down the line for its execution We monitor the progress on all of those initiatives on a monthly basis, and then we report that to the board on a quarterly basis. So there's a keen oversight to that. So among those things, what we're looking to do, which is part of what is about the vision for Wentworth-Douglass, and that is to grow and expand clinical services. So foremost among those areas are obviously to continue to grow and enhance the services being offered at our Portsmouth campus, to really accelerate our clinical integration with Massachusetts General Hospital and the MGB system to bring more and highly specialized services to the seacoast of New Hampshire. And also to expand our service lines. I mean, it's through the efforts like Dr. Mahadevan in terms of expanding our cancer services, through the work of Dr. Mazzini and Denise Palumbo on expanding cardiovascular services and imaging services. In addition to that, our other service lines are musculoskeletal services, women's and children's services, surgical services, behavioral health, and our newest service line, neurosciences. So we have a lot on our agenda, and we've got to get through COVID, but it's amazing that despite COVID, we have a lot of work going on behind the scenes, and we're moving forward in all of those areas and many more.
Fantastic. Thank you, Jeff. I think we have time for one more question before our closing remarks. And actually, Jackie, you might be the best person to answer this, but has this year changed your perspective about supporting Wentworth-Douglass and what we've gone through?
Boy, it's a great question. I've loved this hospital from the first day I walked into it. Many of you don't know, and I'll tell you that I've probably been in 1,500 hospitals around the world, and there is something special about Wentworth-Douglass Hospital. Patients will tell us that. Our board members tell us that. Our foundation board members tell us that. And our donors tell us that. Everybody's happy. They smile. They say, "Can I help you?" And I'm going to say, in this absolutely horrible year that we've just been through, that our caregivers, as you just heard, are world class. They love their patients. They know why they're there. Not only that, they love and care for each other. So they have all stepped up, cover for each other, even if it's out of their specialty area, so that we can put the focus on the patients that are in the most need. I think this year has really shown me two things. One, very proud of Christine and her team for rallying to do things totally differently that we've never done before. Our foundation board has just been extraordinary in rallying to say, okay, look, we still have needs. How are we going to do it? And then when you dial that back down and say, with a world-class team of caregivers, and now what tremendous support we got from the community this year to help us take care of everybody. This is truly community looking out to help community. And to that point, since I'm out of town, I will tell you, for those of you that are home, pick up the Portsmouth Herald or Foster's and look at the full page ad today that thanks all the donors that helped us help all the frontline workers. It's really very well done and very nice. We, at this point, cannot thank you enough. I speak on behalf of many, many people behind the scenes to say thank you sincerely. I hope you enjoyed hearing what impact that you've had. That's why I love this place. It keeps getting better and better. So be healthy, be happy, and have lovely holidays.
Thank you all.